Good morning. Welcome to the Health and Wellness Program. You're listening to Maree Gifkins. Have you signed in? You got a pen and paper there and signed in? Isn't it interesting times? And I'm just so grateful we live in New Zealand. Our Prime Minister has looked after us and kept us safe. She's done her job well. Not that I'm like trying to sway you, but I'm very happy. We haven't had the illnesses and the deaths that a lot of the other countries have had. We haven't had all the misery, and our economy will pick up, and it will be interesting to see what happens when the borders open a bit more and a few more people come in. Are we going to let those in? But at the moment we've done very well, so pat yourself on the back, and we pick ourselves up and away we go again. So today I thought, well, my kind of business is starting from scratch again and building back up again like everyone else's business. So I thought today we might just talk about my history and my beginnings and how I got into this field. So I've been in this field for 25 years now. Originally, we're going back time, originally my career was in the post office. And I was in the DPOs, and my first job out of school was in Flaxmere. And I was in Flaxmere for 4 years, I think it was, 4 or 5 years. And so it was a small post office, and that was when we had telecommunications, postal, and banking. And I enjoyed my job. It was quite a variety. You never knew what the next person was coming in for. You had to learn a lot of different stuff and know what you're talking about to help people. And so I really enjoyed my job. And then as I became older, I started having babies and marriages and all that sort of stuff. And so I took time off for my first baby, and then it was all sort of changed around then, and when I was coming back from maternity leave, I had to choose whether I was going to go into banking or postal. And so I sort of chose postal. It's like, what a shame. This is the worst thing they could do for the country, is separate everything. And it was you could see the country going down from there on. And so I chose postal, and I ended up in Mahora. And then I became assistant postmistress, and and things were good. I really enjoyed the job, but then it changed again, and that branch closed, and I ended up in Mayfair. And then I got made redundant, and I was having another child anyway, so I became a full-time mum. And so our lives change all the time. They never stay the same. Very rarely you get someone in the same career for their whole lifetime now. It just doesn't happen. We're always changing and moving and re-educating, relearning. And so I was now a mum, and that had its challenges. And with my second child, I had quite a few issues with her. And as I said, my career was in the post office, so I knew how to count money. I knew how to balance an office to the cent. I knew how to deal with staff. But I didn't know much about the body, and I didn't know about medical stuff. And if you get sick, you go to the doctor. They have the magic potions and get you right. And I hadn't been exposed to anything else, so that was all I knew, so you just don't know anything else. And so with my second child, she was born with clicky hips. They were the worst the doctor had ever seen. She had to have them up in a brace. And so that was quite a shock for me, to have something wrong with the child. That at least it wasn't life-threatening, but it was, you really don't expect it. You know that there's always a possibility, but you don't expect it. And then when it does happen, it kind of hits you hard. And so, you just get on with it. And then when I started to introduce food, she started to go downhill. She had been sleeping well. She was doing very well. But as soon as I introduced food, things went terribly wrong. And she started to lose weight instead of putting weight on. And she started to become quite grizzly, and she wasn't sleeping well. She started to have diarrhea 3-4 times a day. She started to even vomit 3 or 4 hours after a meal. And so things weren't right at all. And you know instinctively, once you've had your second child, by the time you get to your second one, you know when your kids are well and when they're not. You start to get the hang of it. And so I'd take her to the doctor, and he'd just say, no, there's nothing wrong. She's teething, probably. Go home. And you go, things aren't right. She has diarrhea every day. This isn't normal. It should be, firm, solid, whatever else we want to discuss on radio. And she'd be losing weight, and the Plunkett nurse, and I'd look at the Plunkett nurse, oh, she's had a cold this week. It's probably why she hasn't put much weight on. And they just kept giving me excuses. And it was like, no, there's something wrong with my daughter. And, you start to lose sleep, and you start worrying, and, I was cradling her and rocking her for an hour before she'd even go to sleep. And then she wouldn't sleep that long, and you just knew she was uncomfortable. And you go back to the doctor, and then he just said to me, look, you've got a grisly child, you're an over-anxious mother, go home and rest. And you're like, what the heck? This is not true at all. I'm not a nutcase. But I didn't know where else to go. I didn't know anything. And so I think we had my daughter on infant Gaviscon powder, which did settle her a little bit, but didn't stop the problem. And at that time in the country, there was strikes at the ports or something, and couldn't get the stuff in. So I actually wandered down to Waipawa, and I thought I'll go to a chemist there. They might have some old stock there or old supply there, and I might be able to, because I was sort of running out. Anyway, there was a health shop there, and it was like, I looked at this health shop and I thought, oh, never been in a health shop before. I wonder. So I walked in there, I had my daughter in my arms, and like at this stage, she was 9 months old, and she was the weight of a 3-month-old baby. She was losing weight. This was not good. She was not looking good at all. I must have looked a mess too. And I went into the health shop, and I sort of said a little bit about what was happening, and do you have anything to settle her tummy and maybe help with the crying? And she took one look at my daughter and one look at me and said, I'm not selling you anything. You need to go and see this naturopath. And so she wrote down this lady's name and phone number and gave it to me. Now, we're talking about 25 years ago, or actually 29 years ago. I was so green, I didn't even know what a naturopath was. Could have been a crystal ball reader for all I knew. But I was really desperate. I was desperate for some answers or some help or some guidance, anything apart from telling me I was a crazy lady. And so I rang, and at that stage, she, like I said, she was only the weight of a 3-month-old. I felt I was losing her. And so I made an appointment. I was going to trust, and I was from a Christian family, born again and all that sort of stuff. So, going to this lady, it was like, oh, this is really weird. I'm a bit frightened. Oh, I'll trust God. I'll trust that he's leading me in the right path and he's going to protect me. And so I made an appointment, and my daughter and I went, and there was a lady called Denise Helmbright, and it was in Wakatu. Some of you may even remember her. And so we went in, and she did reflexology on my daughter's feet and iridology. She had a look in her eyes. And all I told her was her date of birth and how much she weighed at birth. And then she told me what was kind of happening without diagnosing. We're not allowed to diagnose. So it's kind of like in the throes of becoming celiac disease. And I looked at her and I said, what's celiac disease? 30 years ago, nobody knew what celiac disease was. And she goes, oh, it's kind of like an allergy to gluten. It was like, oh, I'm starting to feel really dumb here. What's gluten? It's like, oh, it's in the flour. You've got to keep her away from flour. Oh, I can do that. So I went home, and of course we didn't have good old Mr. Google those days. It was like, let's go to the library and study this and have a look. And so bit by bit, I started to learn what this gluten was. So over the next 2 weeks, I took everything I had out. I checked everything, the instructions on the back, the ingredients, and started to learn what this gluten was. It's the protein of the wheat, and took it out of her diet. And she became a normal girl again. Within 2 weeks, I got my little girl back again. The diarrhea had stopped, the vomiting had stopped, the crying had stopped, she was going to sleep easier. Everything was starting to come back on track, and it just blew me away that there were people out there with those abilities that could tell me what was wrong, and I told them no symptoms. And it was like, talk about a load off my shoulders. It was like, oh my gosh. And so it was pretty hard getting the flour out of the diet, because flour is in so many things. And then when she did get something she shouldn't have, she would react. And half a biscuit was enough to set her off for about 3 days. So she had quite a sensitivity to this gluten. And that was my beginning introduction into alternative, herbal, naturopaths. And it was like, I think I need to read more about all this sort of stuff. And this worked, so let me try some other stuff, So instead of the next time the oldest one got sick or something, or he had a bit of a lung infection, I went and saw the naturopath instead of the doctor. And she would tell me what to do. And it was quite often golden seal and echinacea, which is like a natural antibiotic. Onions on the feet, and that pulled all the mucus from the lungs. Now look, if there was COVID around, that would be the first thing I'm doing, is onions on the feet. Congestion, it helps break down congestion. It's the cheapest thing I know that is so effective in lungs, sinuses, kidney congestion. The onions on the feet just help break it down, draw it out and into the bowels, and you go to the toilet. So I started to use these herbal potions, mixtures, concoctions, whatever you'd like to call them. But they worked, and I didn't need the antibiotics. I didn't need to go and sit in the waiting room of a doctor's office, or receptionist, there for an hour waiting for him with all the other sick people that you don't know what they got. It was like, oh my gosh, this is so cool. This is awesome. So it worked, and it worked. And so I kept learning more and more and more. And then I even started to enroll in the colleges. And it wasn't so much I went one day, oh, I think I'll become a naturopath and do this too. It was more, how do I look after my kids without antibiotics? And the more I learn, the less I'm going to have to need the doctors. And then so if I need them in an emergency, that's fine. That's okay. But if I don't need them the majority of the time, and I can help my kids and get them back on track, and they're not dependent on this, that and the other thing, then this has got to be good for me and the children. So that's what I kept doing. I kept learning, and it kept helping, and I started to become quite fascinated in it. And as I said, I went to the colleges. We were living up in Te Kuara then as well, and which is halfway between Hamilton and Auckland. And so I enrolled in the colleges in Auckland, and before I realised it, I had become a naturopath. And it was like, oh, I can actually start helping people. So I started helping people, and I started a clinic. My first clinic was in Te Kuara. And I learnt the reflexology. I went and learnt the iridology. It was the German iridology then at that stage. There's 3, and that's with the eyes, when you're looking into the eyes to see what's going on in the body. And there's 3 different types of iridology. There's the German, the Jensen, which is English, and then there's the American. Of course, they've got to put their hand in there somewhere. And the Germans have a far more sophisticated way of working out what's going on in the body. So I learnt the German iridology, and the more I learnt, the more I was fascinated, and I couldn't believe how this body works, and it can heal itself given the right chance. Occasionally we need surgeons and doctors. I'll put my hand up for that. Of course we need them. But if we can get away with the basic stuff and the normal day-to-day stuff, then it's all good, and just use them for operations and emergencies. That's ideal. And so then I learnt the foot joint mobilisation. There was a Dr. Harvey Lampau that came out to New Zealand. He was from America. He was a podiatrist, and over in America, the podiatrists are surgeons in their own right. They can actually operate up to the knee, whereas podiatrists here in New Zealand, they can't operate. I don't think they can prescribe drugs either. They do your corns and calluses and orthotics and those sort of things, but they don't operate. So in America, these podiatrists are quite unique and quite specialised. So this was a Dr. Harvey Lampau, and he developed this technique, the foot joint mobilisation, over about a 10-year span. And he was in a wonderful position to be able to do that because he had x-ray machines. He could x-ray before and afterwards. He operated on the feet, so he knew the feet inside and out. And so he developed this technique, and then it was too good to keep for himself, so he started teaching it around the world. So I was very lucky and fortunate to be able to be on a class 25, 26 years ago up in Auckland. And I latched onto that therapy. It was like, wow, it was like light bulbs going off in my head. This makes so much sense. You know, it's working on the base, on the foundations of the feet. And if the feet aren't right, the structure's not right, you're not standing correctly. One side could be lower than the other side, and of course then the muscles react, and then the hips one side might come down. And then of course your back muscles aren't right either. One side can be strained more than the other. And it's like a dominoes effect all the way through. It's kind of like, this makes sense. You know, I know the chiropractors will say, oh, if your hip's out, your neck's out. If your neck's out, you can throw the hip out. But who's talking about the feet? This kind of makes sense that you work from the base and straighten up the base, and then the rest of the body can rebalance itself. And of course, we know the body can balance itself and heal itself given the right chance. It was like, oh, this is a no-brainer. So I got to, and I went home and I rang the worst person I knew in Te Wada then and said, look, will you come in and have free treatments? I want to test this therapy and see how good it is. I knew she had back pain and neck pain, and she couldn't afford to have treatments. So she was retired, I think she was as well. So I got her in twice a week for 8 weeks, and I worked on her, and you know, I just learnt it, and I was fumbling a little bit, and I had my books out, and you know, and because nobody knew what foot joint mobilisation was in New Zealand because we'd never been exposed to it before, so there wasn't anybody up the road you could go and practice on or anyone. So she came in and we got to the 4th treatment, and she goes, you know, I am starting to feel a little bit better. My back's not as sore, and I said, this is great. Got to the 4th week and she was walking around the block without pain in her back. And I was like, oh my gosh. And I haven't even touched her back. I've only been working on her feet. And so we got to 6 weeks, and she'd gone away for the weekend, and she'd walked around the Mount, where were we? Tauranga, I think she was out that way, and she'd walked around the mount there, you know, the big hill. and she goes, I haven't done that for 20 years. I haven't been able to. And she had no back pain afterwards. So she was thrilled. And I didn't see her again. Once we'd done that length of treatments, I worked on her twice a week for 8 weeks, and then we stopped. And I didn't see her again for like 8 months. I saw her on the street because it was only a small community. And, you know, I'd ask her, how's things going? She goes, oh, great, it's all holding. Oh, I'm as happy as Lowry. So I didn't see her again for a very long time. And then she must have told people, and of course, you know, small community, so a few people were coming in, and then I had another gentleman come in, and he was a bowls player, and he goes, oh look, this will be a challenge for you. I don't see how you're going to fix my back through my feet, but I'm going to give you a chance. It's like, oh, thank you. And so I started working on him, and we got into about the 4th, 5th week, and he goes, oh, I'm off on bowls all weekend. Normally by the second day my back's really bad, so this will be a good test for it. I said, okay, you let me know next week. He comes in with a look of astoundment on his face. He goes, I don't know how you've done it, but I've had no back pain, even on the second day. I sort of did a good dance and, yippee, this is great. And again, I didn't see him for years once I'd finished the treatment. And so bit by bit, I got all that confidence and went, there's really something in this. This is really cool. And then as I progressed over the years, you perfect it, you get better, you challenge yourself on some tricky people, and I realised that I'm getting about 95% success on all cases, except for those who have had operations. You know, once you've had an operation, that changes the whole equation, and it's a person by person. But if you haven't had operations, I get 95% success. And it's working on the bone structure of the feet, helping to realign them and bring them into the right position. And once the muscles have retoned up, it keeps the bones in place. And as long as you're still moving around, it'll stay. It'll stay for years. You know, some of the worst cases I've had, I haven't seen back for about 5 years. And if I do see them, it's usually for something else. So how cool is that? Not to go backwards. That's awesome. And, you know, the back gets better, the neck gets better, the shoulders are better, the knees are realigning. It just takes all that pressure off. I do get 5% where I don't fix for whatever reason. But, you know, I've learnt a lot more now over the 25 years. So I have all these little tricks up my sleeve as well. And I can use the skin arm machine if there's cut nerves and damaged nerves and nerve supply. And, you know, sometimes need a little bit of reflexology, or sometimes I do a little bit of massage in on the area, the knees or the shoulders, the neck, to just get in and move it a little bit quicker, or release it. It's all tangled up, and get in and release. So I've been very fortunate in my career, because I've quite often been in areas that are small towns. You know, I even lived in the outback of Australia for 3 years in a town called Charleville. And it was red dirt and kangaroos. And so I lived even remotely. And if you have a look on the map, if you go to Brisbane and then you go directly in coast, driving for 11 hours, you'll find Charleville. So it was really remote. It was a very small community. They had the flying doctors there. So it was quite interesting. But again, you couldn't send people to a physio or osteopath or acupuncturist. Those people weren't there. They were kind of looking at me going, what are you doing here? We normally have to go to the big cities to see somebody like you. And so they appreciated having me there. So, you know, and they'd look at me, oh, can you try and do a little bit with my neck? So you start to have a look at it and touch it and feel it, and you trace where the pain is going or the tense muscles, and so you start to learn instinctively, and then they come back and go, wow, that was heaps better, do it again. And so you learn how to help and aid the body and allow it to rebalance itself. So there's quite a few things that are self-taught, but I've been on a lot of different courses, and even to Thailand, where I learned abdominal massage, which is called Chi Na Sang. Do you want me to say that again? Chi Na Sang, which is putting energy into the abdominal cavity, and it's untangling knots and tight muscles, whether you have constipation or diarrhea, working on the organs, the liver, the kidneys, pancreas, all those wonderful places. And so I've learnt quite a lot over the years, 25 years, and yeah, I'm not going away. I'm here for the long haul. I'm not going to let a little virus take me out. So, you know, if you would like to give me a ring and start having your feet done, you know, get back to balance again, feel that confidence in getting out and walking again. We need to walk and move our joints, and that helps the bowels and so forth. So if you'd like to ring me and make an appointment, or even just talk to me, okay, my Name again is Maree Gifkins, and my phone number is 0272 495090. So that's 0272 495090. Thanks for joining me.